you've had two hip
Two hips done, yes.
Yeah. And you had them about 4 weeks apart?
They were
June and July of last year?
Literally 4 weeks apart, yes. The operations, yes.
And tell us a little bit about your sort of physical state before you had your operation. I mean, tell us a little bit about your mobility and pain, etc.
As a child, I had rheumatic fever, and I think this is what do they call it?
Osteoarthritis.
Osteoarthritis. No, arthritis. Yes, yes. And some of the pains that you get as you get older seem to be magnified until you're a whinging old person. Yes. So you can get fun out of it, actually.
You're in a reasonable bit of pain. How about walking? Was walking proving increasingly difficult?
The walking has improved tremendously since the operation, in as much as I have more energy to do it. And I do think it's one of the best exercises you can get, in as much as I walk like I was marching with the toes thrown up, like you would do at a funeral, the slow march. But I can do it as quickly as anybody else can do it slowly. So those sort of exercises are included in your repair job, getting the thing working and happy with it again. And I must say that it's rather nice to have somebody like Mr. Monk to have complete faith in what he does, because I think this helps a great deal, in as much as you know you're in safe hands and you know that you're going to get the best job done. Mm-hmm. It's quite important, I think, to be able to lay back and say, well, okay, fix it.
Yeah. And how did you come across Mr. Monk and the...
It was through my daughter, who has medical friends where she is in Derby, and they are family friends in as much as their children and her children meet and play. And they said, if you want somebody to do that sort of job for your dad, try and get hold of Mr. Monk. And he was quite pleased to be, or I was quite honoured, I say, to have him sort of do the job. And the whole thing was carried out in such a manner that I just relaxed and let him get on with it, knowing very well that I was going to be at least out of pain when it was all over. My advice to anybody who wants them done is to get them done, and to get them done by the best means possible. And I would say that Mr. Monk, in my case, was the best person I could possibly have had. And he did a very good job, and has sort of given me a new spate of life. I also thought that because of my age, he might say, well, you haven't got long, have you? Sort of thing, why don't we not bother? Because it's quite a big operation. But no, they are going to repair as I know they are, and I will be able to enjoy the rest of the years I have, which I'm sure will be elongated, in as much as it doesn't take long to get to 100.